What you see here are some of the arthroscopic instruments typically used in arthroscopic shoulder surgery when we're doing rotator cuff repairs, labral repairs, stabilization type procedures arthroscopically in the shoulder. What we see here is a small little cutter that's used to cut the sutures after a tissue has been reattached to bone. This is a small grasping type instrument that allows us to atraumatically, without injuring any tissue, grasp the tissue to bring it back to where it needs to go. An instrument like this is a loop retriever that allows us to retrieve sutures in and out of different portals as we're working through different portals to utilize to repair and to visualize with the scope again. See here is a small awl that creates a small pilot hole in the bone. Oftentimes this one in particular is used when we're putting anchors into the bone to reattach rotator cuff tendons back to the bone. This is a suture passing instrument that allows a needle is placed through this. The needle is then pushed through tendon type tissue like a rotator cuff tendon that pushes the suture through, that allows us to pass the suture through the tendon arthroscopically and bring it back to the bone. And then after that's brought through the tissue and back to the anchor, this is an arthroscopic knot pusher that allows us to tie arthroscopic knots to tie the sutures of the tendon back to the bone. Some instruments here are typically used on inside the glenohumeral joint or in the ball socket joint when we're doing labral type procedures to free up some of the tissue like an elevator here. A rasp is oftentimes used to roughen up the bony surface to get a healthy biological bleeding surface to enhance healing of the tissue that we're reattaching to the bone. As you saw from all these instruments and the equipment behind me, that arthroscopic surgery is instrument heavy, but it allows us to really take care of a multitude of problems inside any joint. The ones we just saw were for shoulder arthroscopy, but can be used anywhere. These small incisions, small portals, small instruments really let us work around the entire joint and allow a better patient recovery, better patient outcome, a quicker return to function, returning you back to the activities that you want to get back to, and for less pain for outpatient surgery.